Hello, I'm Perrin Beatty, President and CEO of the Canadian Chamber of Commerce, and welcome to the Business of Business. Throughout the pandemic, Canadians have been very focused on health-related issues. How can we avoid the virus? How can it be treated? When will we have a vaccine? And how can our healthcare system evolve to serve us better? It's that final issue that I want to focus on today. My guest today is Juggy Sihota, who's the Vice President of Consumer Health at Telus. Telecom executive with more than 20 years of leadership experience, Juggy has led several emerging technology businesses and operations right across Telus. She's received a number of awards for achievements, including a 40 Under 40 award in 2012, and she's served as a volunteer in a wide range of community organizations. Juggy, welcome to the Business of Business.
Thank you so much, Perrin. Great to be here.
Delighted to have you. Well, let's start at the top. Telus is a telecom company. What's a telecommunications company doing in the healthcare field?
I think it's a question we get asked quite often. Telus made a defining decision more than 10 years ago now to really leverage the power of our technology to address what our CEO, Darren Entwistle, has coined as the biggest social challenge of our lifetime. And that's to help improve Canada's public healthcare system and really drive better health outcomes for all of Canadians. Health, in essence, it became our content strategy and our biggest differentiator. Whilst our competitors were investing elsewhere, things like sports or entertainment and media, we thought, we are in a perfect position to leverage technology that we have as an organization. We are in the business of protecting and moving and securing information to get it into the right hands. We have the infrastructure to do that. And we have a public health challenge that's looking for the private sector to assist. The public sector was certainly overburdened and continues to be that way. And so we decided to get into this space and to help with the social challenge and to leverage what we're really good at for a new sector in a much more deep and meaningful way. And, it started back in 2008 with the acquisition of Emergis, and it was an electronic medical records company that Telus had acquired. And since then, we've invested, upwards of $3.2 billion into the Canadian healthcare ecosystem over the last 10 years, and really have been working on stimulating digital innovation and addressing the unmet needs in the healthcare space across this country. And again, I think at the end of the day, Perrin, we are uniquely positioned to leverage our world-class networks as the backbone to our health solutions. And what we've done very recently is what you've seen is we've expanded into virtual healthcare in a very meaningful way, and that's a very strategic move on our part before COVID started, but a strategic move on our part to really help change the way that Canadians experience healthcare in Canada, so that everyone, no matter their socioeconomic background, they've got equal access to healthcare, and that stemmed directly from our leadership insight into creating a company with strong social purpose, and that was driven by our CEO, Darren.
Well, so you've been in the business for about 12 years. What sort of services does Telus Health offer?
So we are, and people might be surprised to hear this. We're Canada's largest healthcare IT company. We have more than 28,000 physicians leveraging our electronic medical record software. We've got more than 6,000 pharmacists using our pharmacy management software. We have more than 1 million lives covered through our virtual care solutions, both Akira by Telus Health and Babylon by Telus Health across the country. And on Babylon, we saw a demand increase of 10x when COVID started. So, certainly these are really important services and have really allowed us as an organization to step up and address the pandemic challenge. So those would be examples of some of the services that our Telus Health business offers. We have health benefits management as well, which if you have an extended health claim is an example, and we can adjudicate that claim electronically immediately, and we have millions of lives covered through that service as well.
So you were in the fortunate position before the pandemic struck that you had a platform in place, but all of our organizations have been transformed and we've changed our operations as a result of the pandemic. How has the pandemic changed what Telus Health has been doing?
I think you're right. I would say that we saw the benefits of digitizing healthcare more than a decade ago. And, we have been not knowingly, but preparing ourselves for this type of a pandemic situation all along the way. Digital services can scale very easily. And so, we have to make sure we've got the resources behind those digital services to deliver from a healthcare perspective. An example of that would be when we saw the demand increase for virtual care services, we certainly didn't foresee that we would see a 10x in demand for virtual healthcare. What it meant for us at the very beginning of this pandemic was very quickly operationalizing to be able to meet that demand spike that we saw. So practically that meant hiring more nurses, hiring more physicians, training them on our software, putting them into the system to be able to allow people to have an appointment with a doctor or an appointment with one of our nurse practitioners within minutes, which is what they would be accustomed to before the pandemic hit. So it really pushed our scale capabilities, Perrin, and it got us to scale very quickly. There's a lot of learning along the way that is great tuition value for us as an organization. And I think the focus for us is to be keeping, and always has been, but it's more dynamic now, or it's certainly more fast-paced than it was in the past, around what are the unmet health needs in Canada, and how is that changing. So I'll give you an example. We have a service called home health monitoring, where we are able to equip people with the right technology in their homes so that they can be monitored for their healthcare service at home instead of being in hospital. Primarily people who have congestive heart failure, COPD, etc. Those are chronic conditions that usually require ongoing monitoring from clinicians. So we have a service in Canada where we offer that. We partner with government. We offer that service to allow people to be at home. When the pandemic hit, now we have COVID-related issues, people that are suffering from COVID, and certainly we don't want them, unless it's an acute situation, to have to go into the healthcare facilities physically, right? So we retooled our solution and quickly mobilized it to allow people that are recovering from COVID to be able to recover from home. And then we connected them to clinicians so they could do that confidently, knowing that they're getting the right type of care. So dynamically changing our service profile to the new need that is in the marketplace is another example. Further to that, our mobile EMR service to allow doctors who didn't have a virtual care capability in their offices. We want to make sure that all doctors are able to treat their patients virtually, not just the services that we provide through Babylon or Kira. And so we quickly, adjusted our virtual care capabilities that the doctors have so that they can use our technology to see their own patients virtually. And we quickly turned that up as well. So those are examples of, quickly and dynamic, being responsive to the dynamic, looking ahead to see how this is going to change, and adjusting our healthcare services to accommodate for those growing unmet needs.
I want to pursue that point for a minute. You were talking about the interaction between doctors and their patients. 3 months ago, if you wanted to renew a prescription and called your doctor, you would be told, I'm sorry, you have to come into the office and we will do it in person. 3 months ago, just after that, we received emails from our doctors saying, if you get sick, the one thing that we don't want is for you to be coming into the office. We want to be able to do this remotely. Do you see this as a permanent change in terms of the structure of how healthcare is delivered? And what are some of the other advantages that Canadians can find? For example, Canadians living in rural and remote areas. You mentioned elderly people, persons with disabilities would be another example. What do you see as some of the advantages here?
I think first off, I think there's no turning back. I think when necessity is the mother of invention, isn't it? And when you have technology that can help you bridge time and space, and people can see the convenience of that, they can see the utility of that because they have to, because there aren't many other alternatives. It's one of the greatest drivers of adoption of our services that I mentioned earlier. And I think the pandemic has done that, because what's been holding us back, and things have been holding Canada back in this regard, usually are bureaucratic policies, antiquated policies that have been in place. And the healthcare system is one of the last systems to really go through a digitization. You'll still see fax machines in healthcare facilities, and it just kind of makes my head shake and cringe at the same time to say, these are no longer required. Why are we not moving forward? Then the pandemic hit. And when the pandemic hit is now everyone needs healthcare. What solutions are available to them today? They can't go into the clinic, or they don't want to go into the clinic. No one wants to go into the ER because of fear of contracting COVID. And so now, some of the bureaucracy fell away. Still, rules and regulations are really, really important here, but some of the roadblocks that were in the way ceased to become roadblocks. And very quickly, remuneration approaches changed, et cetera. Virtual care fee codes, as an example, where this is how doctors would get paid for a virtual visit. Those became almost ubiquitous across the country. And, consumers and patients are now benefiting from that technology. And now I think once you hand it to them, there's no turning back. So if you can now have a virtual visit, it takes 15 minutes maybe, it could be from the comfort of your home or wherever you are, and you can get your prescription refilled without having to take time off work, without having to go sit in a doctor's office. Why would you ever want to do that again? It's like giving people access to an ATM and then later saying, we're going to take the ATMs away, back into the teller lineup you go into the bank to do your banking. So I don't think there's any turning back on that front. And I would say that, when you offer people the convenience in a safe way, and they can have a little bit more of their life back, there's no turning back from that. And I think we've seen that now as well in a number of studies, early studies that are coming out across the country around virtual care adoption and how people feel about virtual care. And I think that the doctors as well are also embracing this as a way for them to be able to more efficiently see their patients. It doesn't work for everything. If you have an emergency or acute situation, virtual care is not going to be the main source of care. You need to actually go to emergency room. But for so many other things, like what you've just described, virtual care can certainly be a remedy there. And we're seeing provincial governments as well across the country starting to say that, we're not planning to take these back. The virtual care fee codes that were maybe temporary in nature, that they will remain intact. And I think that that's absolutely what needs to happen. So I think that's where it is. And I would say that it spans across other industries as well, not just the healthcare side. I think where people have seen through the pandemic that we can do things differently, we can work differently, and it can be more efficient at times. It can save us time and money. Why would we actually go back to the way that we were doing things before? And at the end of the day, I think what people will begin to realize is, in addition to them saving time, which is so vital for everyone, that it saves the system money. It's healthcare at a lower cost to the system. And if you take a look at how much we're spending across the country on healthcare, more than 50% of provincial budgets today are being spent on healthcare support. It's just untenable. And as we're getting older, we're not necessarily always getting healthier, Perrin, but we're using the healthcare system even more. And so we've got more people over the age of 65 than under the age of 15 today in Canada. And we have a growing and aging population that's going to need that healthcare system even more. And we can't continue to spend more than 50% of our budgets trying to provide healthcare. The private sector, I believe, needs to partner with the public sector, which is what we've done, into help addressing some of those needs.
So we're still in the early stages of digitization in Canada in our healthcare, but there's no turning back on it. From your perspective, how does Canada compare in terms of what stage we're at this point relative to other countries in Europe, the United States, Japan, or elsewhere?
Yeah, I think, in many respects, when it came to things like internet adoption or wireless adoption, Canada was in the early adopter stage, and we have a great level of proliferation and penetration of those technologies. When it comes to digitization of healthcare, I think that we have been somewhat behind. And I think Telus Health in particular, we've taken a leadership role there, and we have been, moving the country too in this regard to try and show the benefits of the digitization of healthcare solutions and the benefits to patients from that digitization. And so we've been helping move the nation forward on that front. But countries like the U.S., in some respects, on the digitization side of things, have been further ahead. When you think about access to virtual care technologies, as an example, and looking around the world, places like Singapore, or even within China and Taiwan, and in that Southeast Asia region, they have been, and Japan, and they have been further ahead on that front than we have in North America. But I think that there's an opportunity now. And I think there's an equalization happening because the necessity is global. It's not just North American at this point in time for the digitization of healthcare services. that there's so much rapid adoption and so much growth happening right now. It'll remain to be seen who actually will end up being a global leader in this space in the next 6 to 12 months. And I think Canada has a great opportunity to be the global leader in this space. And we have been consulted by countries around the world and telecommunications providers around the world too, in looking at our strategy in terms of how we've leveraged the best of us from a telecommunications standpoint, and really it's the best of us from a technology standpoint, and addressed multiple sectors, including the healthcare space, and they're looking to do the same thing. So I think Canada has a great opportunity, and I think Telus Health has done a fantastic job at leading the way on this front.
Well, let's pick up on this business aspect of it. For Telus, this is both a service it's providing to Canadians, but it's also a business. You were talking about our catching up with other countries. Does Telus see this as a business opportunity as well, potentially internationally?
Absolutely. And the use case that we prove it all out in is Canada. We have a small population in this country, but we have a vast geography, as all of us know. And whether it's implementing our mobile cell phone services or setting up our broadband services, there's a lot of geography that we would need to cover a very small amount of population. We do have the benefit, though, from a healthcare standpoint of having a universal healthcare system here in Canada for primary care. And I think that other parts of the world often look at Canada and look at us enviously and say, you have one of the best healthcare systems in the world. We would love to have the type of coverage that you have to be able to do the things that you're doing. And so Canada becomes a really important testing ground for other countries as well, to try and see if you can get it right in Canada, you can probably get it right in other geographies as well. So I think that that's key for us. And we are already, as I said, on an international stage, sharing how we're doing the things that we're doing and partnering with other countries and telecommunications providers in particular to say that, you can do what we're doing here. Here's how we've done it. There are challenges too, I would say, Perrin, though, in where our healthcare system is very laudable. It is expensive. It's not necessarily tenable to be spending the amount of money that we are spending in the healthcare space over the long term, as well as when you take into consideration the aging population group. And I think the fundamental thing that we're trying to get at is revolutionizing access to healthcare. Because in Canada, if you want to see a primary care doctor or you want to see a specialist, it's not always easy. There's 5 million people right now, even today in Canada, who do not have access to a regular family doctor. And you mentioned rural areas and remote areas. I mean, the numbers are worse in those regions than they are in urban sectors. Some of the rural areas, maybe see a doctor once every 2 or 3 weeks. A family doctor will come into the region. And, the stories that I hear from rural areas is, we lost our doctor. We used to have one that used to come every couple of weeks. Now I don't have access to a doctor. So I think that when it comes to access to healthcare, it is a challenge in Canada. And I think the digitization of healthcare solutions can really bridge that. And we're already seeing that. And certainly we can share this use case and the business cases that we have in Canada with countries around the world. And we are starting to do that already.
This brings me to the final topic I wanted to cover. You've talked about how we can expand and improve healthcare services, but what does this portend for other areas? Do you see other elements of the digitalization of society that's being pushed along by the pandemic, where we can improve services for Canadians and where we don't go back to where we were before, but where we can create something that's better?
Yeah, I love that question, because it's looking at the benefits of what the crisis is actually generating for us, right? It's being optimistic and opportunistic of we don't have to go back to the way things have been. Let's find, a new future for ourselves and leverage the learnings that we've experienced through this to do things more efficiently. I think that goes much broader than just on the healthcare side, to your point. I think it goes across industries where we have seen a benefit where I think we've seen a benefit in time and in efficiency, being able to work remotely, being able to, shop remotely. One example I use is I would have never have thought before to order groceries online, as an example. And through the pandemic, now knowing that, it increases the risk of, being around people increases the risk of transmission, of course, and you want to try and avoid going out, and everyone keeps telling us to stay at home. Well, I've now become conditioned to ordering groceries online. And the convenience that offers me is something that I never would have thought of in the past. And, I think post-pandemic, things like that will continue. So where we've recognized and realized a benefit from, not necessarily having to be there physically to do the things that we would normally do, I think we will continue on to do them in an online and in a virtual way. And I think that we should, because I think that it not only does it save us time and it saves us the hassle and probably saves us money, it also probably creates a better carbon footprint because we're not driving everywhere to do the things that we would normally do, as an example. And, it allows us to use the time in different ways. That's the other thing. I think this pandemic has helped us, spend more time with family and, cook more at home, as an example. And so, the benefits of some of those things, I think, will be more lasting. The other piece of it too is we don't know yet. It's still quite early. And, we're seeing some benefits. We're seeing some new economies emerge. We're seeing new businesses emerge. We have to take care of the businesses that are suffering as a result of the pandemic. We need to restart them, and we need to make sure that the supply chains are benefiting from that restart as well and doing it in a safe way. But we're only a few months into this, and we probably have a long horizon yet. So I'm excited, actually, about what else we're going to learn along the way, and to see what the lasting impacts are across many industries and behavioral pursuits for us as citizens, to see what the pandemic will teach us that will be positive and lasting when this is over.
So when we come out of the tunnel on the other side of the mountain, the landscape's going to look very different from when we went in.
Yeah, and I think it'll be better. It won't be better right away, but I think it will be better than what we're experiencing today. And I think the key, though, what I would say from a business standpoint and from a country standpoint, is I think we need to spend a lot of time making sure we help the businesses recover, and maybe we help them recover in a new way versus just going to the way that they were doing business in the past. But I think the focus for us as a country and as a nation should be around innovation and helping seed the minds and the businesses that are focusing on driving innovation, because I think that there will be a lot of learning and a lot of tuition value around innovation coming from this pandemic if we look for it. And I think that it puts Canada in a great position to be, innovation leaders around the world. And I think that is an opportunity that we have not optimized yet as a country.
I think that's a great optimistic note on which to end. Juggy Sihota, thank you for being with us. Thank you for the leadership that Telus is providing, and thank you for your vision.
Thank you so much, Perrin. Thanks for the conversation.